Some people go through medical procedures without any anxiety at all, until one day something changes. You might have had scans, tests, or appointments before. You've coped. You've got through them. And then suddenly your body reacts. Your heart starts racing. Your breathing feels different. You feel tense or emotional, or like you need to get out. And what makes it harder is it doesn't make sense. Nothing has changed about the procedure itself, but something has changed in how your body is responding. So I often see this with people who have never struggled with anxiety before. Maybe often men who are just used to just getting on with things. They're suddenly dealing with a health issue, and what surprises them the most isn't the procedure, it's how strongly their body reacts to it. They'll say things like, "I don't understand this. I've handled much worse than this in my life." And this is where it helps to understand how the brain works. Because these reactions, they don't come out of nowhere. There is always a reason, even if it's not immediately obvious. Sometimes the brain is linking the situation to something from the past. So it might be a time where you felt trapped or out of control, or unable to leave a situation easily. It doesn't have to be recent. It could have been years ago. But if something about the current situation feels similar, like being in a scanner or having to stay still, the brain can recognise that pattern and respond automatically. Other times, the learning doesn't come from your own experience, but from what you've seen. If you've witnessed someone else panic, struggle, or become distressed during a procedure, your brain can log that as something to watch out for. So even if you felt fine at the time. So later, when you're in a similar situation, that memory can quietly influence how your body responds. And sometimes there's no obvious past event at all. Everything may have been manageable before, until one day it isn't. And this is often about your overall capacity at that point in time. If your system has been under more pressure, whether that's poor sleep, health concerns, or just life stress, your ability to cope can temporarily reduce. So on that day, the experience feels more intense, your body reacts more strongly, and then the brain remembers that reaction. And from that point on, it can start to anticipate it. So the next time, the anxiety appears earlier, and then earlier again. And this is often when people start to feel like it's getting worse, or that they've somehow lost control. But this is the key thing to understand. This is a learned response, and anything that is learned can be updated. So in my work, we don't spend time analysing the problem in depth. I explain what's happening in a way that makes sense, help you calm the physical response, and then focus on helping you move through the procedure, feeling more in control. So alongside my private practice, I also work within the radiotherapy department at Belfast City Hospital, supporting patients going through treatment. So I see these patterns regularly. If you've got a scan, test, or treatment coming up, and you're worried about how you'll cope, it can really help to understand what's happening and to know that this is something that can change.